Hi, I'm Dr. Frank Lista here at the Plastic Surgery Clinic, and we've just finished a day of surgery. Actually, it's our first day of surgery in January in the new year, so Happy New Year to everyone. And one of our patients asked a question. So the question was, why do you use drains after breast augmentation when other surgeons don't? First of all, what's a drain? A drain is a little tiny tube like this. See, it's really small. It's only a couple millimeters wide. It's made of silicone. And at the end of surgery, while you're still asleep, the drain is inserted around the implant, comes out through a little tiny opening just beside your incision, one on each side. It's invisible. It doesn't bother you. It doesn't hurt. You can't feel it. One end of the drain is attached to this little tube, this little bulb, which is attached to the tube, and any blood or fluid that collects around the implant comes out through the drainage tube into the collection bulb, which collects any blood or fluid that collect. Now, why do we use drains? Well, it's all about a complication called capsular contracture. Capsular contracture is a complication of breast augmentation where the body forms scar tissue around the implant and makes the breast feel hard. It's not the implant going hard, and it's not the breast going hard. It's the scar tissue around the implant that makes breasts feel hard. Now, capsular contracture is a big problem in breast augmentation surgery, and studies over the years have suggested that incidence could be anywhere between 10 and 40%. And it's really inconvenient because it feels terrible and it makes your breast look not very good. One of the things that we know causes capsular contracture is hematoma, or blood or fluid collecting around the implant. And when that blood or fluid collects around the implant, it can cause capsular contracture. So the idea of a drain is to drain that blood or fluid so that it doesn't collect, and so it decreases the risk of capsular contracture. The drains come out the next day. We see all of our patients the next day. The drains are removed. It doesn't hurt. It's not a big deal. It doesn't leave a mark. And our capsular contracture rate is really low. How low? Well, first of all, there's a study in the the Canadian Journal of Plastic Surgery, which has also suggested that drains reduce the risk of capsular contracture. We've just finished reviewing 1,300 of our patients who all had breast augmentations with drains, and our rate of capsular contracture is 1.3%, which is the lowest published rate of capsular contracture in any study ever published. So clearly, drains help reduce the risk of capsular contracture. So why don't all surgeons use it? Well, first of all, it's expensive. The cost of the drain, the extra time to put the drain in, and the nursing costs to see the patient the next day and take the drain out probably costs several $100s. The other reason why some surgeons don't use it is because if you have a drain, you have to see the patient the next day to take the drain out, and that's inconvenient. So cost and inconvenience. But here at the Plastic Surgery Clinic, that is never a concern. Cost or inconvenience don't matter if what we're doing is better for the patient. And clearly, using drains reduces the risk of capsular contracture, is better for the patient. And we don't care what the cost is, we don't care how inconvenient it is for us. What matters is what's best for you. So it's not a big deal, it's easy to use, doesn't hurt, you don't feel it, take it out the next day, it's no big deal, but it can lower your risk of capsular contracture. And in our study, 1.3%, pretty darn low. So it's a great thing to do, and that's why we use it. So thanks for visiting. Follow us on Twitter or YouTube, Facebook, or on our website where we post commonly asked questions. I'm Dr. Frank Lista from the Plastic Surgery Clinic. Thanks for visiting.